Concerning the vaccination campaign in Quebec, today the minister is accompanied by the Deputy Minister of the Information Technology Department, Mr. Eric Kerr, the National Director of Public Health, Dr. Horacio Arruda, and the Director of the Vaccination Campaign, Daniel Pare. Mr. Dube, the floor is yours. Thank you very much, Rebecca. Thank you. Hello, everybody. And hello as well to my colleagues. Welcome, Mr. Kerr. I'm happy to see you with us. I'd like to begin, perhaps, with an update of COVID in Quebec. There's a clear message. We must be prudent for back to school. And there's one thing that, for me, is very important, and that is that there's a lot of people who are wondering why we are taking so many precautions right now, despite the fact that a great majority of people are vaccinated. And I would tell you that it's back to school, not just back to school, but back to things in general. A lot of people are going back to school, to CEGEP, to university, but back to the office as well. And to be honest, we don't know exactly how this will go, given the variant. There are a lot of people vaccinated, and that will help us. But we don't know exactly to what extent. It's difficult to measure the efficacy of the vaccine, given all of this uncertainty. Now, we know that the variant is much more contagious. And how will this impact our hospitals? I mean, I know that I'm repeating myself, but we do everything that we can to protect our system. So I would like to tell Quebecers, my first message is that we prefer to be prudent, to see how things unfold over the next few weeks. But mainly, we want to continue to have people vaccinated, and the good news is that there's still tens of thousands of people who get vaccinated every day. You know that I like numbers, and I'll give you a few of them. If we do a comparison to see where we are currently, if we do a comparison between August 2020 and August 2021, so beginning of the second wave and beginning of the fourth wave. In fact, if we compare the situation of the 2 Augusts, last year and this year, we can see that the cases over the past 3 weeks, the cases from last year, we had 2,000 cases. This year, compared to last year, we've got 7,000 cases. What that means is that it's an increase of 250%. It's almost 3 for 1, or a bit more. So that is what worries us, to see that increase in cases. However, there's good news. However, when it comes to hospitalizations and intensive care, we're at a lower level than last year for the same period of time. So that's encouraging. But we still have an upward trend. So hospitalizations, so we see that up until now, despite the significant increase in the number of cases, and we know that it's due to the variant, we're very conscious of this, we have managed, thanks to vaccination, to limit effects on hospitalizations and intensive care. But I want to repeat myself, we're just in August, and we haven't yet gone back to school or to the office. So on the one hand, we're encouraged, and on the other hand, we're concerned because September, we know, is where we can see many difficulties, including back to school, including respiratory illnesses. We know what happens in September. We start going back indoors, etc. So that is the point. That's the update on the situation today. I'm going to say a few words on hospitalizations. As we've been saying since the beginning, you know that this is what we follow. It's a number of hospitalizations. So what I think is important to say here, and we will make some adjustments, I think we can always improve. In the executive summary that we publish every day, you know, where we have our 4 big themes, we will make an adjustment because people asked us, well, yes, you put the theoretical capacity for available rooms in a hospital, but we didn't have the true capacity. And that's important. So as of today, you'll see we've changed the graphic. There'll be some small modifications to make tomorrow, but what we'll show you is a number of beds that are available, but that there's staff also available. Because what happened over the past year is, yes, we've got beds that are available and they were reserved for COVID patients, but often we didn't have the staff, the nursing staff. So I want people to understand so that we can truly well explain in the next few weeks to the population the true wiggle room that we have. And to give you a simple example, today you saw we've got 102 hospitalizations, 102. And 102 hospitalizations includes intensive care and non-intensive care, so 70 and 30. But it's out of a real capacity and not a theoretical capacity of 800 beds. So the good news is that today, at the end of August, we're at a use of our available rooms of 12%, 100 out of 800. So that's very good. The issue, what we want to avoid, is for it to continue to increase, and then we'll have to delay some treatments. But at those levels, up until 800 beds, there's not really an impact when it comes to reporting treatments. That's the good news. And in intensive care, it's approximately the same ratio, 29 out of 176, so 16%. So that's where we're at. Why am I mentioning this today when we're at the beginning of the wave? It's because people have often asked us for benchmarks to see where we were and why sometimes we add or remove measures. Well, obviously, hospitalizations is the important measure, but I would tell you, yes, we're at 12, 15%, but it can increase very quickly. You will see. Today, when you'll look at the details, we published them a little bit later today, and I'll end on this point. We had, I think, 14 or 15 new hospitalizations coming in, and they don't leave as quickly. So it could change quickly. But I didn't want to spend too much time on this, but it's important to mention that we adjusted ourselves to give you the real capacity and not the theoretical capacity. If you have any questions on this, we can get back to it. Now, I think that we also have to take into account, and I know that earlier when I was talking about uncertainty, well, the fact that the Delta variant is gaining ground. You'll remember even 3 weeks ago we were happy, we were at 10 or 15%. Now we went up to 30, 40. We're at approximately at 60% now. So we had told you the Delta variant will take over, and the variant has won. It's at 60% now. So we have to continue to be vigilant, and we will do so. So we'll leave that aside for a moment. Now we'll go to the good news. Daniel, right? We're going to talk about vaccination here. The good news is that vaccination is continuing to increase. Dr. Arruda has high expectations, and that's okay. Quebecers continue to be there. And I would say that young people and older people alike, we're seeing that there's really colossal work that's been done by all Quebecers. And it's good to remind you of this because sometimes we're hard on ourselves, but in the last week, let's be clear, with all Quebecers here, we reached all our objectives, all the objectives that we had set in March for all age categories. We're even, you know that we follow this very closely with Daniel, we're now at 86% for the first dose and 77% for the second dose. So it's important to mention this, and we want to thank all Quebecers. And I continue to say that every day there are some additional people who are coming to get their first and second doses. And given where we are in the fourth wave with the Delta variant, we must increase our protection. And Dr. Arruda has said this, and I would ask you today, before we speak about the passport, today we're at approximately 30,000, 35,000 vaccines a day. We could do more than that. I'm telling you, in Quebec, there is still approximately 1 million people, eligible people, who are not vaccinated. That's what 85, 86% means. So I would tell you, if there are some people who are still hesitating, please, we can make a big difference in the next few weeks if you get vaccinated. Danielle's team is there to answer all of your questions. Now, more good news, and particularly for those who are vaccinated. We will talk about the vaccine passport. Over the past few weeks, we've done exactly what we said we would do. We did our pilot projects to test the application for the vaccine passport. This allowed us to test what we call the functionality of the application, but also its robustness. I would like to say that the tests were very conclusive, and I want to thank the businesses that have accepted to participate in the pilot project, and I'm thinking about in Quebec and in Montreal and in Trois-Rivières. And also, I want to thank Quebecers who have accepted to participate in these pilot projects. I think that's important. The comments in the field were very positive. We were asked to make a few adjustments, but I would say that overall, and you can ask your questions, you can ask Daniel some questions. He followed this very closely. I'll let him answer the questions. What's important and what's interesting is that we saw in other countries, and we're happy to see now that BC is also going to adopt a vaccine passport, as Quebec has done. And I think that we have always looked at BC as being a benchmark of good practices. So I think that to see them adopt a vaccine passport, it makes us happy because we had this leadership. And it's nice to see that it's happening in the rest of Canada as well. I would like to thank my colleague Eric Kerr, and particularly his group, his cybersecurity group from the Treasury Board that was implemented approximately a year ago, with whom we worked on security. And I'm going to ask Eric, when I'm done speaking in English, I'm going to ask Eric to speak to us to explain the work that was done, because I think it's important to reassure Quebecers on the passport. One thing's for sure. As promised, we are ready to start on the 1st of September. Now, details that are not small details, I am confirming that all of the places where the application will be done as of the 1st of September, it's as expected, following the recommendation from Public Health. The passport will be used only for non-essential services. The list, the exhaustive list, will be available as of tomorrow, or even this afternoon, perhaps this afternoon. But examples, for example, there won't be any surprises. It's bars, gyms, restaurants, and for big events and festivals and theaters, and particularly what we call physical activities with frequent or prolonged contact. So team sports, including extracurriculars. We're doing a test tonight in a hockey game where there will be 1,000 spectators. So we're continuing to have as many practical examples as possible. I want to say one thing. There were a lot of questions on young people who are 12 years old. When can they be vaccinated? We settled it. We said that the vaccine will only be applicable for young people 13 and up. We're not going to get too complicated with that. I think it's going to simplify the application. Of course, people who are under 13 years of age will be able to go to these non-essential businesses, but I was just saying there was a debate. As long as Public Health or the SIC has not clarified the question of, the date of application and all this, then we're not going to worry about it. It's going to be 13 and up. In closing, on the vaccine passport, I want to say that we're going to continue to speak with the different associations so that we can see if there are adjustments to be made over the next few days and even over the first few weeks, because and I'd like to remind you as well, and this is important, especially when I saw people who were trying to go see how we could cheat the system a little bit. I'd like to remind you of two very things. There are fines and sanctions for inappropriate use of the passport, and there are sanctions in the criminal code for people who want to alter a document. So I'd just like to remind you so that there are no surprises. Now, In the mobile applications, sorry, it's a little bit technical today, but it's important to give you these clarifications, and then we'll continue with Eric. I'm repeating myself because there were a lot of questions following what we did in the pilot projects. There are two applications. I know that you're anxious to see it. There are two applications, mobile applications, that will be available, and that will be available to download on Apple, on the Apple Store, I believe, as of 8 a.m. tomorrow morning. And on Google, it'll follow in the hours or days to follow. But the one on Apple will be available as of tomorrow morning. So there's one application that is available for the business because they will have the reader for the QR code, and that application is called Vaccination. It's not very original, but it's for the person who does a verification of the QR code. And there will be one application that will be used by more than 5 million people, because I'd like to tell you that there's more than 5 million people who have asked for their QR code. That represents 91 or 92% of the people who have been vaccinated with 2 doses. It's an incredible success rate. So these people, as of 8 a.m. tomorrow morning, if they have an Apple phone, they can go on the Apple Store, go get their Vaccination, and a few hours or a day later, Android phone users will be able to do so. The application was tested. It works very well. I like to say that the application allows, like Hydro-Quebec does, like the SAC does, like L'Auto-Québec has done it for its customer service. I think that now it's up to the Ministry of Health to have its own application and to move into an era of modernity with an application for citizens, and I can tell you that it won't be the last one. I also invite all vaccinated people to download the application over the next few days, but I'd like to remind you as well. I'd like to remind you, to remind people who are older, perhaps, or who perhaps have more difficulty with technology, that we will make the QR code available, the paper version. It can be sent through the mail, so people will be able, if they go to the restaurant, they'll have a type of little card, and that will allow people to go to the business if they don't want to have the QR code on their smartphone. We heard a lot of these comments from people who said, well, what if I don't have the right phone? Well, Daniel and his team will handle that. They will mail you the QR code. What am I forgetting with this? I think it's going well, yes, with the application, and you can also print it at home. I think people understood this. So, in conclusion today, and before I speak in English, I would like to tell Quebecers that this is the good news. We had committed to Quebecers. We had said that vaccination is a passport for freedom. The vaccine passport is a balance that we have found to keep our economy open while protecting the population. And with the vaccine and the passport, and I say this both, the vaccine and the passport, we want to avoid closing businesses and to prohibit certain activities. It's unfortunate for the people who refuse to get vaccinated. We will respect it. But we cannot hold an entire population hostage to preserve privileges for a minority that refuses to get vaccinated. We can no longer let non-vaccinated people fill up our hospitals. So we must protect the health of the population. We must protect our healthcare staff, but we must also protect our economy. And I'm repeating myself to the people who are afraid or who hesitate to get vaccinated, take your time. We understand. We saw a lot of people. We saw the percentages continue to increase. We understand. Get informed. Go ask a doctor, a nurse, a pharmacist. Pharmacists are there. They've helped us quite a bit since the beginning. But please, after you've gotten informed, please get vaccinated. Do it for yourself. Do it for your loved ones. And do it for your freedom. The passport now gives us an additional tool that will allow us to face the fourth wave with a certain normality and normalcy. We know that back to school or back to work will be a critical period. We have to continue to increase our vaccine coverage and to respect the measures. Thank you. I'll say a few words in English.
There is only one thing that I want to say, which is very important. There are many people who wonder why we take so many precautions despite the fact that a majority of people are vaccinated. It's back to school that worries us. There are a lot of people going back to school, going back to cégep, university, and at work at the same time in those first week of September. I think it's important to compare the situation of August last year and this year, and we see that the cases during the 3 weeks of August last year were around 2,000 cases, compared to 7,000 for the same period this year, and that's an increase of 250%. On the other hand, in terms of hospitalization and intensive care, we are at the same lower level than last year, but the trend is increasing. That's the difference. In addition, the Delta, as we know, is gaining ground, and we will soon become the mainstream of the virus. We must, therefore, be extra vigilant. On the good news side, vaccination, the good news is that vaccination continues to rise. And we have reached this week 86% of the first dose and 77% for the second dose, which is in excess of the objective that we had fixed in March. Now, on those pilot projects that we've done for the passport, the good news, we are ready for that. In recent weeks, we have, as agreed, we have carried those pilot projects to test the application of the vaccination passport. It has allowed us to test the operability and robustness of the application. We are now ready to start September 1st. The details on the passport for the application are exactly as we plan. As planned, following a recommendation of the Santé Publique, the passport will be used in non-essential services, and the list, the full list, exhaustive list, will be available on quebec.ca this afternoon or early tomorrow morning, but includes the bars, the gyms, the restaurant, but also the festival, the cinemas. And the passport will be applied to young people aged 13 and above to simplify the application. Of course, people under age 13 will be able to continue to frequent those places. With regards to the apps, the application mobiles, 2 mobiles app will be available for download on Apple from 8 morning tomorrow and soon on Google. I think it's a matter of a day or 2 maximum. An app will be available for the merchant, which is called VaxiCode Verif, and one for the citizen, which is simply called VaxiCode. The app has been tested and it works very well, and my colleague Eric Kerr will say a few words on the cybersecurity which relate to it. In conclusion, today we are responding to a commitment we made with Quebecers. That vaccination was a passport to freedom. The vaccine passport is the balance we have found to keep our economy open while protecting the population. With the vaccine and the passport, we want to avoid closing businesses and banning activities. With the fourth wave, we know that back to school and back to work will be a critical period. We must therefore continue to increase our vaccination coverage and respect health measures. Thank you very much. Et peut-être je demanderai à Eric de dire quelque chose. Merci beaucoup.
Merci, Christian. Donc,
Thank you, Christian. So quickly, I wanted to talk about the 3 elements that will bring us to the vaccine passport. First of all, the QR code. I want to tell you that the QR code that we provide cannot be counterfeited. It cannot be changed. It cannot be copied. So I invite those who want to get one in another way than being adequately vaccinated, I advise you to be prudent because because you are the only victims of a fraudulent QR code. That's important to mention because, once again, the QR code that will be supplied by the Ministry of Health cannot be falsified. Now, on the citizen's application and the reader that will be provided eventually, as Christian said, it will be on the Apple Store, on the Google App Store. These are the only applications that must be used. Any other application that is used would constitute a fraudulent act, and there will be consequences to this. Now, on the applications themselves, Christian mentioned it. The General Direction of Information Security and the Government Center for Cyber Defense for the Government of Quebec have participated in the creation, in the tests. There were many people. There were serious tests. They were done without any compromise. And today I want to tell you that these two applications are safe. They work very well, and they represent no danger of fraud and no confidentiality issues. As minister who's responsible for confidential information, I am very comfortable with the elements that we are putting in place for the vaccine passport. I am telling citizens that you can use them safely. And in this context, these applications are safe, and they will protect confidential information, and they will ensure, as Christian has said, they will ensure that our co-citizens will be able to move freely as they deserve once they've had both doses. If you have any technical questions, I'll be pleased to answer them.
Parfait, merci beaucoup. Alors, nous allons maintenant procéder.
We'll now go to the question period.
Présentiel aujourd'hui. J'invite les médias francophones à se diriger vers les micros. Donc, comme à l'habitude, ça va être une question et une sous-question par média. S'il vous plaît, précisez votre nom, votre média. On va commencer avec micro 1.
Bonjour, Annie Guillemette au Québec.
Question. I want to come back to the 12-year-olds and under. How will this work? Will we have proof that they're not old enough to be vaccinated in our phone, in our application, or simply do we have to prove that they're under 12? Yes. What we agreed on, to keep it simple, let's say as a family you go to the restaurant, the 13 and ups must show their vaccine passport and an ID, a photo ID. Somebody under 13 just shows their ID and that's it. Now, on the compatibility of the application with our friends in other provinces and internationally, where are we? I understand that BC will follow our lead, perhaps even with our application, I don't know. But how do we make sure that we don't have two applications, one to go to Ontario, one to go to the U.S.? Well, I'll start, and then Eric can talk to you about the work that he's undertaking. It's a good question, because obviously we want it to be the same throughout Canada. But as you know, we've been talking about this for a long time, and we decided to not wait and to move forward. But we offered to the federal government a month ago, or even more than a month ago, we told them that if they wanted our application, that we could transfer the technology that was implemented. But we asked Eric's group to make sure that if they want to do that, well, no, it's not up to the Ministry of Health to handle that. We will transfer that over to our IT and cybersecurity group. So we offered it to the federal government, but Eric can tell you what we're doing. But I would say that the objective, you know, I learned yesterday in the newspapers that BC was following us, but when it comes to the main director of the Government of Quebec, we are working with the federal government, the Government of Ontario, the Government of New Brunswick, and the Government of BC. We've been working with them for several months already. And in the development, because for the Government of Quebec, with the Ministry of Health, we took on a leadership role on this issue, so the order was to go forward. And of course, the work was done so that we could deliver applications, concrete applications, within a certain period of time. We base ourselves on international standards. So we used the most recent international standards when it comes to creating a QR code and the reading of a QR code. These codes are used throughout the world. So we made sure that we had this compatibility. And I would even say that just about any country can create a reader for QR codes if they use these standards, of course, that will be able to read the QR code that we will produce. So on this idea, the idea is to have a reader that could be used, so that if we do it in Quebec, great. But I'm sorry, his sound cut out. So we're meeting with other Canadian provinces, and by using the right IT tools with international standards, well, we're not reinventing the wheel. So once again, we presume that the other provinces will want to act in the same way. Question? Hello. Minister of Health, you said earlier that we are ready for the 1st of September. Are there inspectors who will make sure that businesses are scanning the QR code? Well, what we will do, because I distinguish between asking for a QR code and understanding that for about 2 weeks, we will let people get used to it. So the idea is not to start issuing fines on the second day or the third day. We're not there. We see that it's not the same dynamics in a restaurant, in Restaurant X, where there's 200 seats and a little bar with 20 seats. We're conscious of this. So what we're saying is that we're asking businesses to start asking for the QR code on the 1st of September. But if ever there's a problem, and there will be some small technical issues, we're talking about more than 5 million people who will have this application. So what we're saying is that we won't apply the penalties before the 15th of September. I think that's fair. There are some people, I'm telling you, we're going to travel around. We'll see how things are going, but we're asking businesses, and that is what our teams are discussing with the federations, to tell them, listen, we're going to ask for the QR code. Please start to use it as of the 1st of September, but there won't be any penalties in the first couple of weeks, to be fair with everybody and to give people the chance to get organized. There will be no penalties before the 15th of September. Question. You talked about sanctions. What will be the sanctions if there's fraud? Well, first of all, it's the same sanctions that we've got for all the other sanitary measures. That is $1,000 from $1,000 to $6,000. But I would go even further. There are monetary sanctions for people who don't respect or who go into a restaurant and the business says, well, I can't let you in. It's the same thing as a mask wearing. Let's keep it simple. Somebody who goes into a restaurant doesn't want to wear a mask, well, it's unfortunate, but the business will have to say, well, listen, I'm sorry, sir, madam, you have to leave. And if they don't leave, well, they call security. Same principle. So the fines can go from $1,000 to $6,000. But what's even more important, it's a criminal act to counterfeit a document, or to falsify a document. So if somebody thinks that they can do so and they can show up with a false ID, a fake ID, and try to show that they were vaccinated, well, that's a criminal offense. We're going to have criminal sanctions. That means that it could have an impact on your criminal file. No, well, we want people to be aware that there's not just a monetary fine. Question? When it comes to the fines, eventually, with businesses, for businesses, what would be the form? Would it be a closure of the restaurant or of the bar, or do you have precise things? Well, currently, if we did not have the vaccine passport, and the cases continue to increase, what would we have to do? Is close the restaurant. That's what we did in the first 3 waves. We don't want to do this. We're giving businesses a possibility with a few disadvantages. We're conscious of the fact they're going to have to ask for a vaccine passport, but we're allowing them to stay open. But if these people don't want to toe the line, and we'll respect it, perhaps there will be some businesses who won't want to do this, well then, public health, through the emergency measures, can say, listen, I have the permission to close your business, as we've done in the past for those who did not want to apply the sanitary measures. So it's the same thing. Question. I'd like to come back to the variant, the Delta mutation. So it's concerning you, and you're probably right to be concerned. There are several studies, including in the U.S. and Israel, that demonstrate that the vaccines seem to decrease in efficacy after a few months. And they're thinking about a third shot. Where are we on this in Quebec? Have you studied the situation? I imagine you have. I've got the best person possible here who will be pleased to answer that question. Yes, the question was asked to the Comité d'Immunisation de Québec to evaluate and to see what's happening throughout the world. I would like to tell you as well that usually, well, according to the vaccine studies that we've seen in the transmission, we can see that the vaccine has an effect because, as the minister said, we've got an increase in the number of cases, but fewer hospitalizations and deaths. One of the factors that we have to understand is that we had prolonged our vaccination period beyond 28 days, and the data has demonstrated that if we waited, we had a better protection. But we'll follow these works very closely, and if for certain segments of the population it's necessary to offer a third dose, we will do so. Question? If we have vaccine proof and everybody's vaccinated, double doses, will we still need to follow restrictions indoors like mask wearing? Yes, what we will do, and I'll ask Horatio to give us a few examples, but the principle, given that everything is happening at the same time on the 1st of September, and that's why we said we've got a big test ahead of us with back to school. We prefer to not loosen up any restrictions because there are some businesses or restaurants who have said, well, if we have the vaccine passport and we have vaccinated people, could we remove the 50% limit or could we do something else? We prefer in the first few weeks to say, let's stay with the requirements that we already have in place. Let's see how things unfold, because I'll tell you, it's much easier to take away than to put more restrictions on. So that's our big principle. Dr. Arruda, I don't know if you want to add something, because it worries us, but I think that, we've said that we've got some wiggle room, but perhaps, Dr. Arruda, I think we can give ourselves a gold medal for vaccination in Quebec. The population was there, and we've surpassed our objectives. That's the first element. But the Delta variant, well, luckily, it still responds to the vaccine well. We haven't seen a significant increase in hospitalizations. There are some, and there will continue to be some, but we know, however, that even if you are vaccinated with 2 doses, you will be protected against hospitalizations and deaths, but you can transmit the virus. So it's not because we require a vaccine passport that the environment becomes COVID negative. That's why we're asking for people to keep things as they are. The CNSST will recommend that workers be prudent, so get vaccinated, because you won't end up in the hospital and you won't die from COVID-19. But because of the Delta, which can be transmitted even if people are not sick, they can transmit it to other people who aren't vaccinated, and that is why we're keeping the measures in place. And we'll follow this situation closely. Like the Delta appeared here. Luckily, we had a third wave that wasn't as bad as what we saw in other places, but we don't want to lose the control. So even places where we're sitting inside, we're going to have to wear a mask. Well, it's going to depend on the protocols that are in effect. For example, in a showroom, people could take off their mask when they were sitting and they weren't singing, and it's the same protocol. So it's not because we have a vaccine passport that we're changing the protocols. It's going to be reevaluated at some point, and all of this will follow the epidemiology, and in October, after the back-to-school effect, we'll see where we are. Second question. The regions where vaccination is lower, do we know why? For example, this weekend we were saying that for the Quebec region, we're talking about 82.5%, whereas in the Outaouais it was 71%. What explains this difference? Well, it's certainly not access to vaccination. The vaccination sites are still open. Before I answer your question, this allows me to say this. We have wonderful results in vaccination, but we can do even better. The staff is always on site. The healthcare establishments have, pop-up clinics, mass clinics. There is no excuse to not be vaccinated. Now, to answer your question specifically, listen, every territory has certain particularities for whatever reason. And Mr. Dube, you said this. If people still have questions, if they have a misunderstanding on the vaccine, go see healthcare professionals. But we're not giving up and we're not letting down, and the vaccines will remain available for vaccination, and that is until Christmas. All right.
Bonjour, Alice Girard-Bossé, La Presse.
Question.
La petite question que j'ai pour vous, est-ce que n'importe qui va pouvoir
Can
télécharger
anybody download the application?
vaccinale? Par exemple, est-ce que
For example, could I decide to invite some friends or family at home and I can scan them when they come in? Well, actually, I would say, technically, you can do it. We're not going to stop somebody who wants to use the reader application to do so. If it allows to have a few more vaccinated people, great, but the objective was to make it available for businesses. But to answer your question, it's a very good question. I don't see why people couldn't, why we would stop these people from downloading it.
On peut pas les empêcher.
We can't stop them. You can go on Apple Store or Google Play Store. You can download the application. This said, obviously we invite the population to not show their QR code to anybody. It's for bars and restaurants, and we're telling the population, listen, your QR code, you only show it to these people. It's as if I said to you, I see you on the street and I say, hey, do you want to show me your driver's license? Well, you may tell me to get lost, right? And you would be right to do so. So same thing for the QR code. It's a document that we will show when we go into a non-essential place, a bar, restaurant, gym, etc. Otherwise, it's information that we should keep for ourselves.
il va y avoir plusieurs festivals là, en
There will
septembre?
be several festivals in September and October.
Vaccinal,
The vaccine passport, will it be required, or
vous envisagez d'annuler
will you cancel these festivals because there's a beginning of a fourth wave? Our objective is to not cancel anything. We want to keep as many activities as possible. That's why earlier I said to your colleague what we will do in the first 15 days, because if there are festivals that didn't have the time, because they sold tickets or whatever, they couldn't integrate the concept of the double vaccine. We want people to ask for the QR code, but we're not going to penalize them. Our objective is to be as normal as possible despite the fourth wave. So we're going to go festival by festival. We'll look with our people in public health to see how we can get organized in a case-by-case basis. But the objective is to cancel as few events as possible.
Oui, bonjour à tous. Ma première question, je vais poursuivre
My first question
ma collègue, à savoir, par exemple,
is,
l'employeur pourrait
can an employer
Vaccicode
download Vaccicode Verif and then check the vaccine status of its employees? If that happens, is this something, do you have a hard time with that? Do you want to prevent that from happening? The whole question of work, and I'm happy that you're asking this question because we will have, well, there are two things here. Currently, to be clear, the recommendation, I'm going to take a detour here, but your question is important. The recommendation that we've got currently from Public Health is that teleworking is recommended. It's not mandatory anymore. You'll remember that before, teleworking was mandatory. Now, I'd like to remind you that the workplace, and I mentioned this morning to my colleague Jean Boulet, who's a Minister of Labor, the workplace is the employer's jurisdiction. It's their right to determine where the employee should work. So, to answer your question, the employee who's double vaccinated and who wants to come back to the office or to the workplace, a bit like some business associations, or as they've said, can you facilitate back to work for those who are doubly vaccinated? The answer is yes, but it's not a question of vaccine passports. It's a question of management, and I don't think that they need to do this, but we will leave that up to each employer because it is their right. It is the employer's management right to determine where they want their employees to work, whether they work from home, and we will never stop someone. Well, you know, we're never going to tell them that they can't work. They can work in person or at home. I understand what you're saying, but I want to know is if the employer uses it to know which employees are vaccinated and which are not vaccinated. What's going to be interesting, given the commission that we've got on Thursday, we will be able to have discussions on this. For the time being, the vaccine passport is not supposed to be used in the workplace, but like I said, we have to distinguish, and that's what we heard from employers. There are some employees there's some people who want to go to bars, but there's some people who are double vaccinated who want to go back to work, who need to see their colleagues or employers who want to do this. I would simply say, every employer has their own situation, and we want to allow this, but for the time being, there's no link at all with the vaccine passport. People who had COVID and who only got one dose, and people who were not able to get vaccinated for medical reasons, do they have something that they can download to have access to non-essential businesses? My colleague here will answer. Okay, so people who had COVID and who had one vaccine dose, when people with their phone or their piece of paper, you'll see it's considered green. And the algorithm behind the tool and the application was developed that way following the recommendation of public health. That's the first thing. For people who, for medical reasons, and I must tell you, it's very rare. It's very, very rare that somebody is either allergic to a product in the vaccine, especially with COVID vaccines, you know. We've had several that are made in different manners, but for these people, a directive will be sent to doctors, and they can fill out a form, and then we will enter it in the vaccination registry so that people can also get the green light on their application, but that is in very rare cases. But that will be made available.
Good afternoon, Madame Mo from CBC Montreal. We're just over a week away from this vaccine passport being implemented, and we've gotten a ton of questions from people in other provinces, international travelers who have booked travel, and they're coming next month, and they want to know what's going on with them. My understanding, and I'm hoping you can confirm this, is that at the beginning, we were told paper vaccination proof will be accepted for people coming from other countries and people from other provinces. I'm looking for a confirmation on that, and whether the topic that was just brought up about people who maybe got COVID, only got one dose, people with medical exemptions, how is that all going to work, and is it going to remain paper?
Very simple. Good question. I hope this will be a simple answer. The first part, because I mentioned it a few weeks ago, somebody from Ontario, from the States, doesn't need any new requirement or ID. You just have to come with their own vaccination proof, double dose, and a proof of residence elsewhere. So driving license, whatever. So it's easy. We will accept. We will tell business owners, restaurant, gyms, that this is the way they should do. Okay, so that's very simple. And with regards to the people that have, for example, got the COVID and the other issue of special cases of sickness, I'll leave Daniel with that.
So for someone who got COVID, basically they got a test, and we have a copy of this test in our system. So this is how we can match one dose of vaccine and someone who got COVID. So no one can say, oh, I got it and I told no one. So it's not going to work like that. So the one who has been confirmed officially, we have it in the system, and this is how it's going to work with the system, with their phone or with their proof of vaccination.
And the second question, there have been protests outside of the locations that held pilot projects for this. But even outside of that context, just last week, I was walking in downtown Montreal and I saw a man walking down the street, not near a protest, and he had a yellow star on his jacket that said no passport. Are you worried that the kinds of things we've been seeing are a prelude to what's going to happen on September 1st? Are you worried about pushback from maybe a minority of people who are going to try to disrupt this system from going into place?
Well, I cannot talk for those people, and I think my colleague at the, I think Benoit Charette has been very clear about this utilization of the yellow star. I think that I will leave that comment to him, as I think he was very clear that this was totally unacceptable and inappropriate. Now, will there be protests? But I think I'm just giving you one numbers. We did vaccinate 86% of the population, and 92% of those people are asking for the QR code. So I think that gives you an idea that people want to be vaccinated and they want to keep a normal life. We went through hell in those first 3 waves. The commitment that we put to Quebecers months ago, when we start looking at the way we could prevent closing businesses, the passport is not the only tool. The big tool is vaccination. So if we want people to be vaccinated and benefit from the vaccination, the passport is a tool to support that. So I think when you have 86% of the population that is vaccinated, that tells you something, and I think we haven't seen the end of it because we're still vaccinating 30, 40, 45,000 people a day. We are at the end of the process, and we're still vaccinating people. So I think that tells you that the support of the population is there.
Thank you.
Okay.
Merci. Micro 2.
Hello, Andrew Brennan, CTV News. I'm thinking of some of the other people that may be falling through the cracks. We've been speaking to some people that are part of the trials for Medicago, and they want to ensure that the research is not in any way impeded or altered by potentially having to get a vaccine that is accepted. They want to make sure that the study can continue and that their results are not going to be impeded, and also that they have access because they feel that they are adequately vaccinated by having been confirmed that they are not part of the placebo trial. So what do? Are they able to show, like international travelers, like someone from Ontario, are they able to show their proof of vaccination and therefore receive access to non-essential services? What do they do?
Well, that's a good question. I think we dealt with that a week or 2 weeks ago when I asked Dr. Arruda to look in. We're looking, and I'll ask Dr. Arruda to complement my point, but we're dealing only with roughly 300 people. And last time, unless Dr. Arruda tell me the opposite, we were willing to consider them as being vaccinated. But I don't know if we have progress on that, so I'll leave Dr. Arruda to comment.
It's clear that it's not their fault if they have not used the other vaccine. They are part of research for knowledge, so we will take that into consideration the same way we will take into consideration the people who cannot get vaccinated because of side effects or like this. So they are a very special, small group, but we'll take care of that and make sure that they don't feel they are injustly not fairly considered in that situation.
Thank you both. And just as a follow-up, just to make sure that things are clear, going back to something that Andy brought up earlier, looking at, as you said, Mr. Dube, that someone who's trying to essentially fraud by providing a falsified document, it's a criminal act. Just so that this is clear, that can come under the criminal code with, if you're found guilty, you can go to prison for something like that. Should we be a little more clear on that? Can people potentially not only receive fines, but also go to jail?
Well, I'm not the DCPC. I'm not a lawyer. I'm just a poor accountant. So I cannot give you the legal thing. The only thing that I'm saying very clearly, this is criminal. So depending on the act, and I think I'm just giving you an example. The minute you have something that is criminal on your case, you cannot travel. So I think the cost of that in terms of quality of life is so huge. I don't know why somebody would take that risk for something that you can get a vaccine for free. So I think that's the answer. The risk is too much.
Thank you very much.
Okay.
Merci. Micro 1.
Hello, Caitlin Thomas, Montreal Gazette. My first question is about what's potentially a small population, but I'm wondering about people who don't have a government ID, but who did get vaccinated. How does the passport apply to them? Because if I understand correctly, you do need to show an ID with your passport?
But you need to have an ID because we want to make sure at least that the picture of the person is the person in being told there. So I think, I don't know, because I know, and maybe Danielle can help me, but we have been vaccinating people that didn't have an address. I know that because you didn't need even the ID card of la RAMQ or, so I think as long as we can get the proof that this is the right person in front of us. So I don't know, Danielle, if you want to comment on that.
Yeah, and we also met with groups who are looking at their itinerant individuals, especially in Montreal. So they know that situation can happen, and they will work with them, especially to maybe to get a copy of their code, create that little business card, so that will be very easy for them, and to make sure they're going to be able to, especially if they've been vaccinated, they're going to be able to have access to all the services that the passport will give to them.
Second question is about just communications to businesses and gyms and restaurants who will be implementing the vaccine passport. How will you make sure that they know about all these little sort of details, for international people coming with just their paper proof, and for maybe homeless people? What's the communication like? Because I realized that just anecdotally, when restaurants reopened in the spring, some of them seemed a little bit unclear on the government guidelines that applied back then. So I'm just wondering how you communicate.
Danielle, you're publishing some sort of a guide that will be available tomorrow, I think. On all those details will be in a guide that it will be on the web. I think it's
on Quebec.ca. All the information, and honestly, I believe that that everybody's waiting for this information. I don't think it's our passport is secret anymore. So everybody will look on the website tomorrow, and I think that site will be very popular.
Merci. Micro 2.
Hi, Olivia O'Malley, Global News. I know you spoke about this in French, but after September 15th, I think the date was, how are you going to ensure that bars, restaurants, and these non-essential services are, in fact, checking everyone's QR codes who is coming through the door?
Well, it's simple, the same way we've done with masks. We had people going around. Sometimes we were called that people were not respecting the mask. Remember, when we started that, it was not easy, but people... And I think there is a sense of the community, the people that are there, that they say, wait a minute, those are the rules, and we want the people to respect those rules. So sometimes we get the calls. Sometimes it might happen that we have some business owners that will not respect the rules, but I think the majority of them will respect the rule because they don't want to lose the right to have their business open, right? So I think it's very comparable to the wear of the mask that we had months ago. I don't think that's different.
And there's a lot of businesses that fall underneath this non-essential QR code, vaccine passport. What about for their workers? Will all their workers who come through the door have to have 2 doses?
And again, for the reason I explained to one of your colleagues before, there is a big difference in the code, the work code, the labor code, sorry, to make sure that the right to work is a right. So if your work is in the restaurant, you cannot ask or you cannot request that for now unless we change the code. And I don't think we want to change the code in the next 2 weeks. I mean, so, but really, I think that we are willing to work with this, can I say, issue, having maybe some employees that are not vaccinated, because that's their right to work. But they need also to follow the measures. They need to have the mask. They need to have the distanciation. I think if the debate goes further and if the situation change, I think that the environment, for example, of a restaurant is quite different than the workers that are in the hospital or in the CHSLD. So that's the reason that for now, this is the rule. We're following the labor code. And this is the reason that we had also a recommendation from public health that it was the time to maybe push this to further for the employees in the health system, because the environment is totally different than a restaurant or a bar, because you're dealing with very vulnerable people. So for that reason, let's have the discussion on those issues on Thursday, because that will be at the commission in Quebec City for Thursday and Friday. And after that, we'll adjust if we need to adjust. Okay?
Thank you.
Merci beaucoup. Merci d'avoir été présent. C'est ce qui met fin à ce point de presse.
Thank you. That is all for the press conference. Have a good day.